Welcome to JOA Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hey, hello. Happy Wednesday here, December 4th. My name is Joa Rivas. I am a Pilates and yoga instructor and also a birth and postpartum doula from Toronto Yoga Mamas. And I'm here today with Nav Grewal. She is a pelvic floor physiotherapist in the city of Toronto, in the GTA actually, in the whole area. And we are together working in a prenatal and a postpartum education series for all the mothers in the community of the podcast and also the YouTube community. So we are sharing information that can be very helpful for you. And today we're talking about Diastasis Recti. And I wanted to simply say hi to Nav and just welcome her again to the show of Joa Rivas. How are you?
Thank you so much, Joanne. Thank you so much for having me again.
Thank you. It's been very nice to share all this information. Last time we talked about the C-section and all the challenges that come with the C-section. By the way, that was one of my clients just saying bye. And she actually my client had 2 C-sections, and we were talking about it and how that can affect you, right? And basically now here I'm in the studio where I teach classes, and I'm just practicing and teaching Pilates every Thursday in this studio. And I wanted to share today about Diastasis Recti. And in this episode, we will share about what is Diastasis Recti and how we can actually treat it when it's already diagnosed. So please welcome yourself again and tell us who you are and what is Diastasis Recti.
Okay. Hi, everyone. So my name is Nav. I'm a pelvic physiotherapist. So I have special training post-graduation with pelvic physiotherapy, and I treat women prenatally as well as postpartum. So sometimes they come to me postpartum and they want to return to activity and return to fitness. And part of that examination is checking their abdominals to make sure that they can return to activity safely and that no damage will be done or harm will be done. And so one of the things that happens during pregnancy is because the belly is growing, the abdominal muscles then have to stretch out to accommodate for the baby, right? So for 9 months they are stretching, and then afterwards, what can happen is, and this doesn't happen for everybody, is the abdominal muscles don't go back together to where they're supposed to be, and there can be more than a gap than we would usually like. So everyone has a gap. So if you think about seeing someone who has a six-pack, there's that line down the middle, right?
The linea alba?
What's that?
The linea alba?
Yes, exactly, the linea alba. And so the linea alba is connective tissue in between the abdominals, and so it's normal to have that gap, but we just want to make sure that it's not so wide that, you know, when someone is lifting weights, that it's putting pressure in that area, or doing, you know, a heavy physical activity that is putting pressure in that area, because eventually that there's the risk that that might lead to hernia. Okay, so that's one of the biggest thing. So a lot of women are probably now thinking, okay, well, how do I know if I have this separation? I usually test that. If it is something that, you know, usually the test that we do is, you know, a little bit technical, but if someone is noticing that they have coning, bulging, basically it feels like there's like a bump in the belly if they lean back or if they do a crunch.
Yes.
That's one of the signs. So it's, instead of like the flat stomach, it feels like there's like something coming out. So that's one of the signs. And if they know they have that, then they need to, you know, like avoid heavy lifting. It's very hard to, you know, avoid obviously lifting your baby, but beyond that, to avoid heavy lifting and to seek help from a pelvic physiotherapist and or going to their physician.
So, is this also being affected more somebody that is being training and being more active than a normal person that is not that athletic?
It's interesting you mentioned that. I've seen patients like without no pregnancy, no children, and they can have diastasis because if they're quite active, but they're not using their muscles appropriately, they're not using correct biomechanics, they're not breathing properly, then that can also lead to diastasis. I had a 70-year-old man come to me with diastasis.
Okay.
So it can, and so it generally, like, physical activity shouldn't really cause it, but it's the way that people are doing exercise. So say postpartum, someone returns to exercise, but now their body is different, the muscles are engaging differently. That can also lead to it, or might lead to it worsening, or it's not improving.
And the distance of the diastasis normally is between 2 to 3 centimeters, or how big it could be this gap in between?
There's no normal value. It's anywhere from like 10 millimeters, which is like a centimeter, to like 1 to 3.5 centimeters. That's the normal gap, but there's no really like a normal value for like what the separation is actually supposed to be. The big thing is to look for that bulging if someone has pain in that area, if they're noticing there's a lot of pressure.
And this can lead into a hernia?
Yeah, because that's the part that's keeping the abdominal contents and the organs inside, right? So if you think about inguinal hernia, so a lot of guys, they get a hernia in their groin area. So basically what that is, it's a lot of pressure coming outwards, and then the contents start to come out. And so the risk with that is, so if someone has abdominal hernia, then they have to do surgery and do a mesh surgery to keep everything in.
Correct. And what about the exercises that you could do to treat this type of issue that woman and men, actually, anybody can actually have?
Yeah. So one of the big things for prenatal is to do deep core activation, and also to be doing your Kegels, which we have talked about previously in another kind of one of our series episodes. And so why that's important is because a lot of women think, oh my gosh, I have, or I might have abdominal separation, so I'm just going to focus on doing just abdominal work. It's very important to strengthen the muscles around. It's just like if you have a weak shoulder, or you know this part is going to be stretched out for 9 months, you want to be strengthening, like I would want to be strengthening my rhomboids, my back, scapula, shoulder blade, biceps, that kind of thing. So for that area, you want to be strengthening back, glutes, hip muscles, pelvic muscles.
Yes.
So that's a great way to prevent that.
Very important that what you're saying that is because when I teach Pilates and yoga and all these core classes, every time we talk about core, people identify core equal abs. For some reason, I'm not sure why the population thinks that, but actually the core, as you were saying, it attaches the upper body with the lower body. So it's all muscles attached to the pelvic floor, which are interconnected. So I believe the glute activation and that area, the fire in that area is so important. Most of the people that don't know how to activate the glutes, it will develop very weak abdominals. So the abdominal region is going to be supported by all these muscles attached. And even the tension that people put in the QL and the quadratus lumbarus, it could be also because there is not awareness of that area, like glutes. So for glutes, I think we have talked about how to work around it. So even if you have the diastasis recti, it doesn't mean that you only have to now engage the abdominal wall for exercises. You may have to also work on the muscles that need to be contrarresting the force, which are the posterior muscles. So I use an elastic band that it creates a lot of attention into what's happening with our abductors and the hip when it rotates, how it activates the glutes maximus. So I think the band could also help a lot of people to bring awareness into that area. And I think, as you know, breathing is the most important tool that we all have, right? So many times clients and my students, they breathe so shallow, so deep breathing. And I think this is also related to Kegels. Don't you think that Kegels, breathing, and that core activation are all connected together?
Yeah, well, this goes back to our previous episode where we were talking about breathing, but also posture. So if someone afterwards is doing a lot of lifting, but their posture is like this because during pregnancy there's a lot of weight here, and then afterwards, they get the weight is gone, but the posture is still like they're leaning back like this. That puts a lot of pressure on the abdominals, and then they're doing just abdominal work. They're not focusing on like the rest of the core. And if you're like this, you tend to breathe into your chest as well. It's kind of impossible to breathe into your belly if you're leaning back like that, right? Yes. So having that correct posture and doing the work for the back is really important. So you have good posture so you can actually breathe down into the belly.
Yeah, super important. Now, are there exercises that are not recommended for people with a diagnosis of diastasis recti, like planks or maybe like cover-up, a stretch? Is there anything that you, with your knowledge, can tell us?
Cobra is actually fine because all the weight is on the stomach. Big one is crunches.
Okay.
Because if they're seeing, especially bulging, anytime they do this kind of crunching motion, then that's just aggravating that area, right? And a lot of women afterwards, they're not just doing crunches. They could be doing holding the medicine ball and then rotation with their feet up. That's a lot of pressure. Over here, plank. Most of the time, when people are doing plank, they're not engaging their shoulders or glutes, I find. So if my patient can do that, I'm okay with it. But because most of my clients, they cannot do it, then I usually say no planks either.
So and another analogy that everybody can actually practice now is zipping up the jeans. Why don't you tell us about how do we zip our invisible sexy jeans?
Yes, and the reason for zipping up the jeans is because there's a deep layer of the abdominals called the transverse abdominis. It sits underneath all the bigger muscles that usually we can feel and see, and those muscles keep the core connected, so in the diaphragm on top with the pelvic muscles. And so if someone especially has diastasis, they can engage those muscles. So a good way to do that is you want to be in a lying down position, have good head support. Knees can either be bent with a pillow underneath or straight out. Doing belly breathing for sure, not into the chest. And then on the inhale, just breathing down into the belly like a balloon is opening. And then with the exhale, very, very gently, pretending like you're zipping up a tight pair of jeans, and you kind of have to set very subtle engagement of the deep core muscles. So if your hands or fingers are on the abdominals, you shouldn't feel bulging out, but tightening more so.
Yes. Yeah. What about the frequency and the length of these exercises that will actually make it worse?
For that one, so length and frequency, so you should be holding it for the duration of your breathing. Okay, so if you're inhaling it for the duration of the exhale, that's how long you're holding it. Never hold it if you're holding your breath. We don't do that for any exercise. And in general, I like to work my patients to fatigue. So once you've reached that point of you're feeling that the other muscles are kicking in, you're stopping it. Or if you find, I'm actually feeling sore now, you stop it. Just like with any other muscle group, if you're doing bicep curls, I generally I don't ever say, okay, 3 sets of 10. You need to work that muscle to fatigue, so you know that you worked it. If you find then you're using your whole body to do the bicep curl, we need to stop doing it.
Okay. Yes. I teach the hanging. So basically you hanging and you engage your core by hanging. But this could also be a little bit difficult for those that have no strength on the wrist. But I think when you hang, your spine is stretched, right? So there you can actually create that vacuum on the TVA that can strengthen the core too. So, but that's more of an advanced level. You can start, like you're saying, laying on the floor, very safe, and then slowly coming to standing position. I like to do planks standing with a paddle, like the paddle pulling and pushing with a cable. That's also a very good way to do that. I probably will have to do like certain series of movements doing this in a better set, because I'm actually now sitting on a lotus pose. So if I do this, I think I will have to set my camera differently. But it's good to share that you can actually go on levels. You can start strengthening from the floor, safe. From there, you can start standing, and then you can do the hanging. So that could be like a progression. Eventually, these muscles will close slowly. I've seen it on my clients, but it's a very slow process, right? We have to have patience, and we have to have proper progression, so you don't really go too fast. Do you have any of the experience of how long does it take to heal and to like close these muscles, so people know that there is a way to find a solution?
Every patient is different, but what I've generally seen, I'm gonna give like the top kind of like limit, like 4 to 6 months for if someone's coming in. It depends on when they come in to me, because I usually do follow up 6 weeks postpartum. But if they don't come to me, say till 3 months postpartum, right, and they've continued to lift, or say they've waited a little bit longer, depends on the healing time for my clients as well. So everybody heals at different paces. I have seen patients recover in weeks, but the top limit is usually 4 to 6 months.
Okay. Nice. Well, I think this is what we could offer. Do you have anything that we could add to the Diastasis Recti? Is something that we didn't talk?
I would just really encourage women postpartum to give themselves some time to heal and not push themselves, and really think about their body as a unit versus individual parts, and not to see the core as just abdominal muscles. It's everything surrounding it as well. And stop sucking in your stomach and breathe properly. Because sucking in your stomach and they think that they're engaging their abdominals, we don't do that with really any other body part, right? Like, I'm not clenching my biceps all day long, right? So why do that in the abdominal area? Every area has to move. So I encourage movement versus static holds for areas, and really just allowing your body to heal and nourishing it. Yeah.
Yes, it's true. Wise words. I totally also recommend everybody to search for a proper professional physiotherapist, or somebody that you can find that is qualified for this type of work, because it's actually something serious. If we don't treat it on time, it could get to a hernia in this case. So we just only educating from our scope of field, the field that we can, but be very careful with this and try to never self-diagnose. I think this is something important to know, because a lot of people just find their way and then later they regret of what they did. So just find a professional. We are in Toronto. Dr. Nav Grewal is here in Toronto, so she can also see you and evaluate you and see where you are. You may have it and you may not have it, and she will definitely be a good advisor for that. And definitely for me, Pilates is being so transformational for my scoliosis and for my clients. And we do all this practice of breathing and activation of the core, and it's never a easy fix. It's always a continuous practice. We never stop. But thank you so much. Thank you so much, Nat, for the talk today. I'll see you next week. And remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.